DoD. 22 were in the Marine Corps, and my infantry combat tours were in Desert Storm and up in Mogadishu, Somalia. And next, Doc Fonseca is going to give you a disclaimer and introduce himself.
Good evening, everyone. And as usual, I'm Dr. Luis Fonseca, U.S. Navy Hospital Corpsman, retired after 22 years of active duty. During my tenure in the Navy, I was involved in the Battle of Al Nasiriyah, which got me awarded the Navy Cross. Today, we're doing things a little bit differently, and I get to introduce our guest. Today, we are honored to welcome Frank G. Rando, a U.S. Army veteran whose career has spanned military operations, medical intelligence, emergency preparedness, clinical medicine, and veteran advocacy. Frank served in the U.S. Army as a nuclear, biological, and chemical specialist, nuclear weapons specialist, NBC and CBRN non commissioned officer, Special Forces medical sergeant, and intelligence sergeant. His military service included assignments and operations experience across the Middle East, Africa, Central and Latin America, and Europe. Following his army service, Frank continued supporting national defense as a military medical intelligence analyst and force health protection subject matter expert for the defense. For the Defense Intelligence Agency Armed Forces Medical Intelligence Center at Detrick, Maryland. In that role, he maintained his top secret clearance and analyzed medical, environmental, epidemiological, and operational health threats affecting U.S. and allied forces around the world. His work included disease and injury surveillance, health threat mapping, foreign biological intelligence analysis, and the development of intelligence products designed to protect troops and mission assets. Frank also contributes to intelligence sharing among U.S. and allied defense organizations and helped develop training materials and curriculum focused on emerging health threats, weapons of mass destruction, CBRN, medical defense, and biomedical countermeasures. He has taught numerous courses in medical intelligence, NBC and CBRN preparedness, and operational health protection. In his civilian career, if that wasn't enough, Frank has served as a physician assistant, surgical physician assistant, surgical first assistant, cardiopulmonary medical clinician, and medical examiner and evaluator for the Department of Veterans Affairs Medical Disability Examination and Evaluation Program. He is also educated and experienced in occupational and environmental health science and epidemiology. His background includes extensive work as a respiratory therapist, paramedic, tactical paramedic, hazardous materials technician, toxicology medic, hyperbaric medical technician, and dive medical technician. Frank has also served as a healthcare educator and instructor across multiple disciplines, including as a National Association of Emergency Medical Technicians instructor for tactical emergency casualty care, tactical combat casualty care, pre hospital trauma life support, and all hazards disaster response. Frank is an international author with 80 published articles and has served as a guest lecturer, adjunct instructor, and presenter in academic, medical, and healthcare settings across the United States. He spent 13 years as an instructor and subject matter expert for DHS and FEMA, supporting the emergency medical, I'm sorry, supporting the Emergency Management Institute, the Center for Domestic Preparedness, the Noble Training Center, and the National Domestic Preparedness Consortium. He has also consulted, advised, and instructed for the Department of Defense and Health and Human Services asset, including preparing and developing national security, homeland defense, and emergency management briefings for the National Guard Bureau's National Military Civilian Institute. Beyond his professional work, Frank remains deeply involved in the community emergency preparedness. He has served as a Stop the Bleed and active shooter slash active violence countermeasures instructor for schools, businesses, industries, and government agencies. Most importantly, Frank is a relentless advocate for veterans' health. He is widely regarded as a subject matter expert on military toxic exposures, assessment, and the long-term health effects impacting veterans and their families. I would love to welcome Frank G. Giraldo, but next we'll have Andrew Doc Berry to let us know how we are so honored to have Mr. Frank with us this evening.
I am the one that's actually honored by you guys. And I appreciate the invitation and the ability to participate in this tremendous type of podcast that serves our veterans, which we all love so much and which we all want to help as much as possible. That is quite an introduction. Thank you for reading all of that, but you didn't have to. We are of the breed that are the quiet professionals. But I figured I'd detail the stuff that I do so that I could come on board with a little bit of expertise and what things we might be talking about. And I do appreciate it. Thank you so very much for doing that extensive introduction. Anyways, I am proud to be here. I want to thank Doc Berry and you guys for having me on. And it is not unusual that Doc and I have had prior discussions on veterans' health issues, especially PTSD. And one of the things that I've learned to call by a number of other people, not necessarily my quote, but known as moral injury, which is something I would like to maybe touch upon, when we progress into this podcast and describe exactly what is the difference between PTSD and moral injury. And I'm also, as a clinician, I'm especially interested in the effect of TBI in accentuating PTSD or being related to PTSD, because traumatic brain injury causes tremendous changes in the chemistry of the brain. As we all know, you get hit in the head, your brain ain't going to be the same, right? So you get a head injury. I'm a victim of a head injury. I'm a victim of a TBI myself. So I could definitely relate to all of that and what it does to actually help to bring upon things like depression and not so nice thoughts in your head. Let's put it to you that way. Okay. So anyway, I love to be able to describe a couple of things which happened to me a while back while serving actually on a UN task force in Bosnia. Okay. So this basically involved the injury of children. And we know that happened a lot, and it happens a lot as so-called collateral damage in war. Okay. I never liked that term, but it is what it is. Okay. And that's what it's known as. And some of them just happen to be children. And as you know, from encountering those types of injuries, I had a 4-year-old boy actually die in my hands during treatment. So in my arms and kind of like bleeding out on me. And that's something that I face almost every single day, is that imagery that has happened from man's inhumanity to man, let's say. And, and the unfortunate realities of war. So, having said that, I know that there are plenty of veterans and first responders that I know tune into this that suffer from vicarious trauma, right? Trauma received while, doing things and actually experiencing what other people have gone through and taking on that trauma to themselves. And another thing I'd like to describe, and which was actually, I don't know how it was, but it must have been a case of either serendipity or a case of divine intervention, where I came upon this book called Unbreakable Valor. Not that I'm pushing the book, but it is also by a former retired, well, he's a retired U.S. Army major now. And his name is Drew Webb, and he was a medical sergeant with the Special Forces, serving in a variety of areas. And it's an excellent book, and it kind of it's like a reflection of what had occurred to me while serving as a on SF Medic in a lot of these areas around the world. And I recommended reading. And part of the subtitle is this isn't PTSD, this is moral injury. So as you know, PTSD is very common, and you do not have to be a combat veteran or a first responder to receive it. It is something that can occur, let's say, in sexual assault cases, okay, which I've seen as a paramedic. And I've also seen working in the spectrum of law enforcement operations, and haven't seen that a lot in my time, sexual abuse, child abuse. So it's not something that is, beholden to the special ops community or to, regular Army or regular Navy or whatever, any of the branches. No, you do not have to be a combat veteran to acquire PTSD. And Doc, you can back me up on this as well. And it is something that can happen in anyone for a number of reasons. Okay. And we all know this. So having said that, I wanted to just, equal the playing field among all of us who are human beings and who experience traumatic events. But being that this is more of a first responder, veterans oriented thing, I will stick to that. One of my first runs in New York City Emergency Medical Service was actually dealing with, it was on a Christmas Eve, and I was a brand new young minted EMT, actually from the state, the state certification thing, and went on an ambulance run to a tenement area in Brooklyn, actually in the kind of like the section, I think it was Bedford-Stuyvesant, I don't remember because it was so long ago. It's either Bedford-Stuyvesant, Greenpoint. It was Greenpoint, Brooklyn. So it came over as a maternity call, which was quite joyous. It was Christmas Eve, birth of Christ. And to me, that was like, holy mackerel, just a young dude, flying to this call. I got my maternity kit ready. I got all of this stuff ready. I was overjoyed that I might be bringing a new life into the world. Turned out to be a crime scene. It turned out the boyfriend of a female that got pregnant and had been pregnant for some time, of course, an abusive boyfriend, actually cut her open from the tip of her vagina to the chin, underlying chin. And the baby was also, I guess you would say, bisected during that assault. And I just wound up going home in tears, covered in blood. Could not work the rest of my shift. I had to be relieved. And I've held that for many years, and it was a very vivid scene. I'm saying to myself when I got there, what the hell are all these cops doing here? Why do we need all these cops? So, I went up to, and he says, dude, when you go in, well, he didn't say dude at the time, but he said, guy, when you go in there, just, it's not good. And he said, what? I'm thinking that they bled out because of something like, a miscarriage or something of that effect, or, some other reproductive emergency. And it turned out, no, that it was actually the site of a very brutal homicide. And so that stuck with me quite a while. So having been subjected to both the civilian side of emergency services and as well as the military side of military medicine, and the whole collateral damage thing in war. So I've been hit pretty badly. And when I got my TBI, I found that I was also very, very, highly depressed. And on a couple occasions, you would have classified me as being suicidal. And holding it in is never a good thing. I mean, just because you could jump out of a perfectly good airplane doesn't make you any less, impervious to the damage that war and violence does to your psyche when you see it firsthand. So that's pretty much my synopsis of a contribution to our discussion right now. So,
Doc Bear, before we go on, did you want to introduce yourself real quick, brother?
Doc, I'm sorry. Did I steal your glory there for a minute? I'm sorry.
And it's all good. I think he's frozen anyways.
That's what happens. You just go off.
It's all
and
good.
Just keep on talking.
Well, I'll tell you what. I'll get a hold of Doc Barry on the back end, so we'll keep pushing through. But Frank, you mentioned something very interesting, and I know Nate is going to laugh when I mention this. So, yesterday at midnight, I had to turn in my thesis paper. So I just graduated. Well, I graduated with my undergrad in clinical psychology. And my paper,
Which is fabulous, and congratulations.
Thank you, brother. Thank you.
That's
And
not
my-
a hard. That's not an easy thing to get.
Thank you, brother. And my paper's title is Moral Injury and Veteran Suicide: Gaps in the VA and DoD Prevention Models.
Interesting.
Yes. Where were
Well,
you
what do you
8
know?
weeks ago? Where were you 8 weeks ago when I was starting this paper?
Dude, I'm sorry. I wish somebody would have told me something. I would have filled you in on a few things.
Yeah, well,
You know,
Frank, let's start with there. Let's start, this whole because you and I both know moral injury in accordance with psychology, and when it deals with whether it's combat or whatever, it's fairly new. It wasn't until I think it was 2009 that the APA finally accepted it as an actual terminology or whatnot.
Yeah.
What for our audience out there, can you explain what really entails moral injury? What separates moral injury from PTSD that makes moral injury 6 times of a greater chance for someone to actually follow through with suicide, right? It doubles the chances
Yeah.
for female veterans to actually go through with the act of suicide. What is that? Break that
so
down
let
for
me
our viewers.
let me see, and Doc, I may need your expertise on this end, but my definition, okay, is defined by my MOS, which when I first started out was a 91 Bravo special or
Okay.
S, which is the Special Forces medic designation before it turned into 18 Delta.
Understood.
So as an 18 Delta, I could say that you have to realize that you are, besides 18 Delta is not your usual medical MOS. 18 Delta is a combat arts designation, okay? Just like 18E or 18A or any of those 18 series in special forces.
Understood.
So having said that, 18 Delta, okay, which means that first of all, you are a warrior. And secondly, you are a healer. And this is where the moral injury sets in. Because you have to be out there to carry out 1 minute. You may be putting a chest tube into somebody and saving their lives, or doing a decompressing a tension pneumothorax with a needle to allow people to breathe, right? To your victim to breathe. So the man down might be having difficulty with a tension pneumothorax where the air builds up in the pleural cavity, and and it presses against the heart, and it could be fatal. You have to come to grips and relieve that, followed by a chest tube, right? Okay, so the next minute you could be picking up, a weapon and firing on someone, okay, an opposing force, and actually engaging in battle, which actually you start taking people out because, in special forces, you shoot very well and on target. And, and then another time you may have to go back to that patient and take care of that patient. This is where the ambiguity comes in as to why am I here and what is my role? Okay. So you're picking up a weapon, you're taking a life, and now you're saving a life. That creates a lot of moral confusion, and sometimes it's very hard to compartmentalize, right? And, and you have to focus on putting yourself in one role, changing roles, and becoming a warrior, then going back to becoming a healer, as opposed to regular service, where most combat medics, okay, I mean, nowadays they carry weapons, but not that often called into actually engaging the enemy. In special forces, that happens all the time.
Right.
The doc is a soldier, he has to be able to pick up his weapon or carry out other aspects of an operation.
Mm-hmm.
Okay, I was cross-trained in intelligence. That was my cross specialty. So at one moment you might be able to not just take care of the sick and injured, but you also have to realize that although that should be your priority, of course, life, limb, and everything else, but we found out over the years that fire superiority is actually more effective in saving lives than some medical procedures are. And so we're going to be working under care under fire type of model, when you're out there. So in me and in others, and I know that in old Doc Webb here in this book, he suffered the same ambiguity as a lot of us had in the being in the SF mission, and taking care of business by eliminating the enemy, but also going back and doing your medical duties as well. So in PTSD, which can happen to anybody, there's a common denominator there, with some type of traumatic stress that was induced by an event. But moral injury, I believe, leaves you more in limbo. So it leads you to believe, why am I here? And I'm here to save life. I took an oath, even as a Special Forces medic, or as the oath is called, the oath for the Special Forces medical aidman, AIDMAN. But here you are, having to pick up a weapon or planting a mine, or setting up an ambush, or taking charge of other military duties, that will save lives of your own men and your allied forces and stuff like that. But yet you're expected to take care of the injured. So that, to me, it was a definite. Here I am practicing bush medicine is what I call it. You're not a full scale physician or anything like that. Not even at the point of physician assistant, even though you are an unlicensed physician assistant at that point. So doing a lot of the chores that a physician's assistant would do, probably in emergency medicine. But the thing is that you're back and picking up a weapon a few minutes later, and firing away. So I think it's more of an impact for the veteran to have suffered from that, as to and also, I mean, if we remember back to some of the unfortunate examples of unhonorable conduct that has occurred in the past, like the My Lai massacre and things like that nature, that creates moral injury to have participated in that. And I missed Vietnam by a year and a half. Before you know it, it was the evacuation of Saigon in 75. So I missed that. And I wanted so bad to go. As a kid, I wanted to go real bad, and I missed it by a year and a half. But thankfully, maybe the good Lord prevented me from going that route, because the Vietnam War was a tough one. And I respect my dear brothers and sisters that have been through that. I welcome them all home. I think they were among the most courageous soldiers in the modern era, that didn't get any recognition like they did in World War II, for example. I mean, World War II guys never spoke about their moral injury. A lot of them held it inside. And their so-called PTSD, or as it was once known, it went through so many definitions: shell shock, combat exhaustion, and interestingly enough, in the Civil War, they called it the irritable heart.
Yes, they did. Yep.
Am I right?
Correct.
So they called it the irritable heart back in the day.
Yep.
And the irritable heart changed, terminology, until we finally arrived at post-traumatic stress disorder.
Right.
And so to me, it is a, there is definitely a difference in a very personal sense. And I think one of the things is that it's very isolating, and it's also very ambiguous as far as, the ambiguity is what really, I think, sets it off in a lot of folks that have especially if you have dual roles, or you're involved in like a friendly fire situation or something like that.
Yeah, and I think what we're seeing a lot as well too when we talk about moral injury is, there's like 7 categories of it. One of them is betrayal, and it's betrayal either by an institution, or it's betrayal by those that were put in charge, right? Your leadership that is
And
there
it
to
is
protect
betrayal.
you, right? And it is betrayal. You see a lot of these veterans that, and and I'm just speculating here, right? But you see a lot of these veterans that go in for PTSD, depression, anxiety, mental health disorders, right? And I personally think we do a good job of treating the PTSD, the depression. We have all of these different modalities, but the underlying cancer, if you want to call it as you will, is that moral injury, is that feeling of betrayal from this institution, or like you said, the massacre, right? Where a veteran or service member goes in to a clinic to get seen and is telling the provider, I had to do this, I had to do that, and this happened and that happened. And whether it was Iraq or Afghanistan, or it was in Vietnam, we all know that in a lot of places in the world, they will take young boys, right? 10, 11, 12, 14-year-old boys, and force them to fight, right? And so the service member does their duty and then comes home and feels like, but it was still wrong. That was still a child. That was still, someone that, and it hurts them deep in their soul. And a lot of what I feel, clinicians will always revert back to well, you did your duty and you should be proud that you did your duty well. You're executing orders. That's not fixing the problem. You're just, trying to pacify someone that's deeply hurt inside for either executing orders that they had to execute, or for feeling that betrayal from their leadership or the organization that they rightfully serve.
And you're absolutely right, Doc Lewis and Luis. And I'll be honest with you, and that is one of the things that affected me with children. As a matter of fact, I wrote an article a while ago called "Suffer the Children," and this was for a international magazine that I was the editor for. I'm not the editor, I'm sorry, I was a contributing American or USA, it's an international journal, actually on armed conflict and CBRN and a lot of those types of things. And I wrote an article about the effects of war and the humanitarian effects of war specifically on children. I mean, we got these kids in, for example, in other areas of the world, like Cambodia or, Kampuchea or whatever, that step on landmines all the time. And there's a big landmine problem around the world with children and also adults stepping on unexploded ordnance that, needs to be removed and causing loss of limb, right? So, and we have that to deal with as well. And moral injury is caused by a lot of people that may or may have not, participated in military operations there or whatever, and it goes back to them as well. And, there's a lot of tragedy out there with that, with unexploded ordnance, landmines, what have you, around the world. If you remember, Princess Diana is one of Princess Diana's so-called pet projects, I guess, was to address that very devastating issue that has turned up in areas of the world for kids and others that have to deal with that. It's a very tragic set of events. And having said institutionally, okay, so a lot of people know and feel that the VA has failed them, right? And I know for a fact, I've dealt with atomic veterans, and I told Doc this in a little discussion we had the other day, that there's actually a Facebook group called The Invisible Enemy, and I urge everyone to please join that page. And the reason why, we have a lot of veterans who have been abandoned by the VA that are atomic veterans who've worked at places like Area 51, who've Tonopah Range is another area, Nevada Test Site, which I've been to a couple of times, another area there where they did atmospheric nuclear testing. Well, guess what? These folks can't even get any benefits from like PACT or ionizing radiation benefits or any of that crap, any of those benefits, because of the fact that these are highly classified operations and they can't even apply for veterans benefits because they don't exist, literally don't exist. And there's only one or two senators that are actually addressing this issue. These guys are, literally unsung heroes that have given their lives for this country, okay, in such a fashion that they are dying by the dozens from the effects of radiation exposure and toxic chemicals that they used, okay, in their work at these ranges, even places like Hanford, okay, which is a Cold War legacy site that's still being cleaned up, and it's still leaking stuff into the Columbia River. We're talking about things that are radioactive for hundreds of thousands of years going into that river, and God knows what these folks have been exposed to. That's not even being told. And that's just not the only site. Believe it or not, there is one of the first places where they started developing yellow cake for, uranium and all that was in St. Louis, Missouri. At Millikendrath Company, which was a chemical company, and they dump waste all over the freaking place. And now it's in people's homes. It's in the soil. They have to close children's parks because of that. the whole area outside of St. Louis, the suburbs and stuff like that, a place called Cold Creek is totally contaminated. And people are suffering. They're dying of cancers. Dying of cancers.
Yeah.
And
I don't know if you mentioned it in the whole thing, but it also reminds me of the US I was in the Navy, so I know more Navy history, but the Navy sailors that they would have off, in the ocean and would test the nuclear weapons to see how it would affect them on the ship. And then when they got out of service, they were like, "What are you talking about? We never did anything like that to you guys." And they never received their health
so
benefits.
does this not add to the PTSD or superimpose? Doc has a question or something.
Yeah, let me just throw something in here. Betrayal factors into moral injury a lot, and leadership betrayal is often openly spoken of in this webcast, and it's nothing new. Um, Go back, if anybody so chooses, go back and read the Iliad. Okay, Greek mythology, 3,000 years old.
That's high school,
What a lot of
Doc.
amen
That's
to
high
that. Well,
school.
depends on what high school you go to.
I didn't like that
Anyway,
book at all.
but
Go
the
ahead.
subtitle of it, yeah, the subtitle of it is what you may not remember. It's the Iliad, the Rage of Achilles. The Rage of Achilles.
Yeah.
Doc went to
And
high
what
school with Achilles.
Yeah, and what happens here is after the countless campaigns for the motherland or fatherland, Achilles went around the world and saw more blood, more death, more destruction, more of inhumanity to man than anybody. And he came back to find that his trusted leaders had betrayed him. And that is what filled him with an indescribable rage. And he referred to that betrayal as being worse, more traumatic than the trauma of combat. And that, gentlemen, is what we're talking about here today.
Yes. Thank you for that. That's important. Yeah. Yeah.
And it is because one thing that I have such a new fondness for when people say, "I did my research on this," and you really know that they did the research and not, "Oh, I researched this," and they fucking pulled up two Google websites, right? Because when you do real research, it sucks. But anywho, um how PTSD and all that is all fear based. You know what I mean? It all comes down to fear based. Am I safe? Are we safe? Where moral injury cuts down into your soul, it questions, kind of your humanity. It questions your morals, your beliefs, and
Exactly.
and when you get that deep wound in there like that, that's the part that we need to start figuring out how we start helping to to heal that sort of trauma.
I want to
also-
share. I'm sorry. Go ahead, Doc.
Just this won't take long. Luis has heard me say this many times, and Nate too. Often we run across this betrayal for the very first time when we are very young. And the significance of that is an old song from the 70s by Rod Stewart. And it's the title, "The First Cut is Always the Deepest." And that right there is why it sticks with us for the rest of our lives, is the loss of our virginity, the loss of our innocence, because we have no basis for comparison until that moment when we experience the betrayal.
Well, yeah. Well said. Well said. I'm glad you didn't break into Maggie May or anything like that. But well said for sure. But anyway, to make a long story short, I just wanted to present to you folks a very dear friend of mine, Dr. Larry Miller, whose son committed suicide on the steps of the VA. And he was a Marine sniper. And, you know, and so Dr. Miller is also a veteran, and he's emergency medicine physician in San Antonio who does medical missions to El Salvador like twice or three times a year or something. He also invented the EZ-IO, which is an intraosseous device to administer blood and intravenous fluids through the bone. He is the inventor, and he's a very dear friend of mine. And we often speak, and what we fell upon is that his son, Mark, had a great degree of both PTSD and moral injury, and they wrote a book together, which is, I forgot the name of course. Anyway, it is about his role as a military sniper and what type of moral injury and PTSD, of how it affected him and all that. He got so frustrated with the VA system, and they were offering him antipsychotics, antidepressants. You know, they give you the whole, you know, pharmacy trip, you know what I mean? When you go there, basically, yeah, you know, like pick what you want type of thing. It's like having like a candy store. That is not the answer. Not the answer at all. And it's amazing how antidepressants, if you ever see those commercials on TV, you know, in little print it says, may induce suicidal tendencies. I mean, really? I mean, the side effects are worse than the disease. I mean, worse than the drug, rather, worse than the cure. I mean, it's like really crazy. It's just ridiculous, you know? And so he is a very kind of like antidepressant doc. And he's also a very potent advocate for veterans. And he's a very dear man. And he suffered quite a loss. Quite a loss. So now he is a secondary or victim of, he's the collateral damage of PTSD and moral injury and all of that stuff. And I know he holds on to his Christian faith very well, and goes to that quite often, you know. But anyway, to make a long story short, I would love for him to come onto this broadcast, and I would love for him to be able to share the story of his son. I think it's so important, and it will make a tremendous impact on our veterans and our first responder community as well. I think because those things are, you know, they're kind of like very, very, the gray area, you know. I mean, like I said, when you're a police officer, when you're a special agent, like happened last night, okay, and you're guarding the president of the United States and something goes off, I mean, you're not immune from PTSD, no matter how trained you are. You're not, you know, right. Something really deep happens, you're not, you know, you're not immune from moral injury either. And so as a police officer, as a emergency services worker of any kind, paramedic, EMT, healthcare worker, you know, a firefighter, obviously, all my dear firefighter friends that I love so much. And they is just part of that whole thing that brushes off even on the family. It's like almost like getting a secondary infection from the primary one, you know? Yeah, so there's your collateral damage within the family right there. So that causes issues. But I want to mention too that there are many, I am a Gulf War veteran. I was in Desert Shield and Desert Storm. I want some of my patients, a lot of them are Gulf War veterans. And look at the multiple assaults they got. One of the most toxic battlefields in history next to World War I.
Yes.
PTSD on top of that, right?
The cancers.
And cancers.
Yeah.
Now, no, in my experience, I don't know about you guys, but the word cancer strikes fear in the heart of people like nothing I've known. Okay. You know, even more like being a victim of an armed robbery or whatever. It strikes the fear of God into you. And tell me if that doesn't add to that PTSD. I mean, it does. I'm very
Oh, and
into mind body medicine. That is one of my
And then, and then to
yeah,
have
and there's a
several decades of people telling you it didn't happen.
and it didn't happen. That's another thing too.
Or
Having I mean, look what happened with Agent Orange initially.
mm-hmm.
No, they brushed it off, right? They brushed it off. Now they recognize that, hey, you can get this. There's a laundry list of shit that you can get from exposure to Agent Orange, soft tissue sarcoma. One of my best buds actually served in Vietnam and was a helicopter, a chopper crew chief, and he was part of Operation Ranch Hand. Okay, which spread the crap all over the place. He survived one of the longest living. He was one of the longest living survivors of intense radiation therapy, as well as chemotherapy. Plus, they took he had a hemipelvectomy, which took off everything from his part of his pelvis and his entire leg, hip, leg, and everything, because of soft tissue sarcoma, or what's called osteosarcoma, whatever you want to call it, osteocarcinoma, that affected his whole bone, hip, leg, everything. He had a sarcoma. And intense radiation therapy, I don't know, God knows how many rads he received, but he was on the books for that, before the largest amount of radiotherapy doses absorbed and tolerated. So losing a limb, and this guy, handsome, strapping guy, nicest guy you'd ever want to meet. I mean, patriot 100,000%, had to go through this. And at the time, they were saying, when he was in, after Vietnam, he came out, and that, no, there's nothing. Would say, so you were exposed to this stuff, so what? There's no correlation. And now there's a laundry list of signs and symptoms, including in reproductive hazards and things like that. Reproductive effects and everything, sperm count, you name it, fertility, whatever. Yeah.
Let me just jump in here. As far as when a person is traumatized, right? And the first time they open up about being traumatized, this is a crucial juncture when the healing can begin, or it's when the trauma gets set in concrete. When a person is traumatized and the person feels listened to, when the person feels cared for, when the person is in the presence of somebody they tell it to, and the other person does not at the fuck all make it about them, doesn't get mad, listens, etc. A very considered, rock solid response, so that the victim feels heard. That's the first thing. But if you open up about being traumatized, or in this case, what we're talking about here, poisoned, and you are dismissed, ridiculed, downplayed, denied, etc., that right there, my friends, sets the trauma in concrete. And guys like us in our professions have our work cut out for us to try to undo that damage, which is seismic.
Yeah. And that's why I say, why I try to emphasize that people have been, I'm going to say it, totally abandoned by the government. I don't know how else to say it. I'm just going to say it in plain English. They've been abandoned by, by the very government that asked them to serve. So this is the type of thing that I believe, for example, like with the A veterans, the atomic veterans, it is ludicrous, and this has been going on now. For years, that they haven't been recognized because of the classified work that these veterans were involved in places like Tonopah Range and Nevada Test Site and Hanford and the myriad others that are out there. Okay.
They could the country could take care of them, even though it's classified. We just choose not to. If we can have black ops and black budgets, we could just as easily cover them, compensate them without telling the world everything that happened. We just choose not to. That's the betrayal right there.
Yeah.
We choose not to take care of them.
Yeah. And then I'm asking from a younger veteran to two of my two older brothers that served, during the Desert Storm, Desert Shield era, when all that toxic fumes and all that stuff. I would ask a Vietnam veteran era about Agent Orange, but we don't have one now. So I'm asking how it must even hurt more when you're being told at that moment in your life, no, this doesn't cause anything. We'll be fine. We have all the protective measures. And then 30 years goes by, 40 years goes by, and now things are being declassified where the government knew all along that, yes, Agent Orange does cause all of this shit. We have the studies to show it, but we still decided to
Didn't
use
do
it
anything.
and lie to our service members. Yes, the toxic fumes from Iraq in 1990, they knew would cause all of these things and still lied to our service members and said, no, y'all are crazy. What are you talking about? That has nothing to do with it. And now it's coming out that, hey, actually it had everything to do with it, right? And I think as well that also leads to a lot of the younger generation, how much they question all of mandated vaccines and mandated this and mandated that. So I
Yes.
guess yeah.
One of the biggest culprits, two of the biggest culprits, I believe, that has resulted in Gulf War illness, of course, the oil fires and all of that, right? But I believe that the anthrax vaccine, now it's interesting, I'm not anti-vax. I am questionable vax. Okay, now, right? Okay, I mean, we know that without a measles vaccine, there'd be like, the mortality of children would be up tremendously, right? As well as adults, right? Okay, so we know that smallpox was eradicated by vaccination, right? So the last smallpox case was back in 1977 in Somalia, and after that, nothing. Of course, it was weaponized by the Russians. They weaponized 10 metric tons of smallpox. This is the medical intelligence stuff now coming out. Okay? 10 metric tons with refrigerated units on their warheads to keep the germs cool. That from satellite imagery. Okay? However, having said that, it would have caused several epidemics, right, by using those types of weapons. That just goes to show you a lot of the stuff there. We talk about COVID-19, mandatory shots for that, basically, if you're working in healthcare. A lot of problems with that, correct? But the anthrax vaccine, a lot of these vaccines had what's called adjuvants. They're used to boost the immune system, okay? And many of them had toxic effects. And a lot of them at one point, now they don't use dimerisol, which is a mercury derivative, to preserve it against, bacterial contamination. They stopped using that, apparently. And, there are mercury-free vaccines available. But, however, having said that, that's bad enough, mercury, Alice in the Wonderland and the Mad Hatter, creation the Mad Hatter. So mercury was used to make, to process felt, making hats. And it's one of the most toxic compounds known on Earth, next to things like dioxin, for example, which is an Agent Orange. Anyway, to make a long story short, so the anthrax vaccine and several other things like the PB pills that were used to pre-treat us for nerve agent exposure. Okay, specifically, there was one particular nerve agent which is known as Solman, and the military nomenclature for that was GD. Okay, it was a GD compound, one of the G series nerve agent compounds. Solman has a 2-minute aging time where the enzyme that's responsible for controlling nerve transmissions gets blocked or gets inhibited, and the neurotransmitter keeps on firing. Okay, so your nerve impulse doesn't stop. This enzyme is supposed to come in between the synapses of the nerves, right, and actually stop the process normally, physiologically, so that you don't go into seizures. Well, this enzyme gets bounded up with Solman in 2 minutes. That's the length of time that you have to administer the NAC kit, NAAK, remember those? And if you don't administer it in time, you got the 2-PAM chloride and the atropine in there. If you don't administer within 2 minutes, you have a dead casualty. So they came up with the PB to pre-treat us so that the stuff doesn't bind. And that's one of the things that actually, it's an anticholinergic compound. And what it does is that it actually, prevents that nerve agent from attaching in a way, let's just say, okay? So because of those things, and because that particular PB and all of these other things like they've given us, plus low-level nerve agent exposures that have occurred, okay, when we were taking out some of the facilities that were operated in Iraq to store and produce nerve agent, went into the air, and people, and vets got, the soldiers got exposed to a lot of that. There have been about 37 documented cases of ALS, Lou Gehrig's disease, that came out of Iraq within a cohort. A few from UK, the rest from the US. What are the chances that a perfectly healthy adult that went into the service comes out of that service, 37 of them, with ALS? What is the epidemiological chance of that happening? Probably zero.
Yeah.
Right?
It's funny that you mentioned that.
So there had to be an environmental influence.
Right. It's funny that you mentioned that, not haha funny, but we'll use that term, right? It's funny that you mentioned, the ALS thing, because recently I've had so many friends that are passing away, and it's not even the suicide anymore. It's all cancer related shit, man.
There is a lot of cancer out there, and it's all environmentally related. All of it, I think. Everybody in their body has oncogenes, which could be switched on and off. And they can be switched on by environmental chemicals. That's been proven. That's a fact. That's in science journals. that you could read, and find out. There's many, many studies done on that. And there is an environmental molecular biology relationship there that can cause and could switch cancer on. Go ahead, cell, proliferate. And the cancer cells start growing. And our atomic veterans, our Gulf War veterans, our Vietnam veteran, all of the veterans that have been involved with toxic exposures have been subjected to the possibility of that happening down the road. And going back to the World Trade Center exposures, there you go. I mean, that's a disaster with an incredible, ominous legacy. There are cops and firefighters still dying from World Trade related environmental illness, period.
And not even the first responders. I mean, the people that were just working there, the people that
And the people that were working and in the community around it as well.
Mm-hmm.
Absolutely right.
And the everyday person that happened to be by that there, and instead of running away from them, said, "Hey, people need help," and just ordinary citizens, man. Yeah.
So I am a holistic clinician. Okay, I believe I don't pull back from things like alternative and complementary medicine and say, no, this is not going to work for you. I am not a big pharma guy, that says that's the only thing that's going to help you is drugs. Why can't some of these veterans be placed into programs where they can receive those types of benefits that can come from an alternative, or let me just put it this way, a holistic medical approach? Don't throw antidepressants at them, okay, for their PTSD all the time. How about some alternative stuff? Acupuncture, biofeedback, right? Massage therapy, even.
Right. Equestrian therapy, blue light therapy.
Blue light therapy, red light therapy, all of that good stuff. Right, Doc? Mm-hmm. I mean, they just don't get the benefit of what's out there. Now, there's interesting Nova Scotia, what's it called? Nova, I keep on thinking Nova Southeastern University in Florida has a College of Osteopathic Medicine. Within that College of Osteopathic Medicine is the Institute for Neuroimmune Medicine. So, and they have invited Gulf War veterans there, and it's still ongoing, to do some clinical studies on things like some of the things we've been talking about, alternative therapies. And I've referred a lot of people to that particular institute. They are fabulous, and they love Gulf War. They love veterans, period. Okay, very veteran friendly. And talk therapy, absolutely that. Group, I've been in group. And things like that. Absolutely. But there are a lot of these alternative therapies that are out there, complementary or alternative, that you can combine with conventional, what's called allopathic medicine. However, and integrate it. Here in Arizona, at the University of Arizona, we have a tremendous Andrew Weil, who's like one of the fathers of alternative and complementary medicine. It's his institute, and we have veterans in there too. I know that for a fact, that are benefiting from some of the programs they have there, for rehab and treatment, as far as a lot of conditions go, including any particular addictions and stuff like that, and working out very well. And you got some happy campers coming out of these programs, as opposed to depending on the VA.
Makes me wonder, seriously, it makes me wonder with the alternative therapies that we're talking about, as well as, if you want to call it talk therapy, which is what I do. and one fine day Luis will be doing as well. Fuck it, he's already doing it. He just doesn't know it yet. We are being lobbied. All of the above are being lobbied against by the
Yeah.
AMA in
Yeah.
in favor of meds, which are 1, 2, 3, wham bam, thank you, ma'am, treat them and street them. The mantra
Yeah.
that sickens me, and that is, it's cheaper.
Yes.
And getting back to what you were saying earlier, I remember I was talking with one of my Vietnam vets, and he said the only time he stepped into the VA, there's a psychiatrist who had a pile of meds on his desk. He says, "You pick whatever one you want, I'll write you a script." And
You
the
were
guy
telling me
told
about that a few days ago, I
he,
remember. Yeah.
yeah, he half shouted. He half shouted. He goes, "I don't want pills. I want somebody to listen to me." And he said, "Well, we don't do that here." And is it any wonder why we have a suicide problem? Now, as Frank, I've sent you the old vet talk. As
Yeah.
I say that as well as in the old chief talk. It's pretty simple to advocate for talk therapy. You open your mouth and the pain comes out.
And the pain comes out.
Okay. And the
Absolutely.
pain comes out. And I have seen so many guys and gals coming into my practice asking for help is the hardest goddamn thing they've ever done in their lives. And somehow, some magical thinking that they have is that talking about it is going to make the situation worse. And I can't tell you how many times at the end of a session or an intervention or whatnot, they come in, heart palpitations, sweating, hands shaking, teeth grinding, the whole goddamn thing. And at the end, I'll ask them, "Hey, man, how do you feel now?" And it's a question that never seems to have ever occurred to them. And they look at me
Absolutely.
rather
Yeah.
quizzically and they say, "Doc, you know, I feel strangely relieved." And that to me is evidence enough for you open your mouth and the pain comes out. And what
Hmm.
happens is once that pressure, that emotional pressure, that anxiety, that depression, those nightmares, those memories are finally ventilated, the pressure goes down so that God help us all, the veteran can
Yeah.
finally start really thinking again. And I'll stand by that. You know, I one thing I'll tell you guys about Frank's um, articles, the ones that I have read so far, thank God, are very humanistic. I haven't read all of them yet, Frank. I'm going as fast as I can,
Oh,
just to
no, that's
let you know.
fine. No, take your time. If any of you guys want copies of anything, let me
Right.
know. I'll share whatever I got.
Perfect, because it's humanistic.
No
It's
biggie.
not. It's
We're all
not
in this
buried
together.
in. That's right. Yeah, it's Frank doesn't write stuff burying it all in jargon. He makes it understandable by anybody, and that's the method of a true rabbi, a true teacher. And he wants to get together with me and write up a couple things too. And initially, I flinched because whenever I hear research, I think pie charts, I think statistics, I think experimental design. Those are languages I do not speak. You know where my research comes? You know where I get my information from? When I am looking into the eyes of somebody who is finally spilling their guts out, bawling their eyes out, that is raw data of the highest order. That right there is where I get my research from. And I lean
Absolutely.
toward what's known as qualitative stuff, which what I've seen of Frank's work so far is very qualitatively or humanistically oriented. The pain comes through, the humanity comes through, and is not cased in jargon. I just wanted to say that out loud for everybody to hear. And thanks for sending me your stuff, Frank.
I
I'd be honored to
appreciate that.
collaborate.
Thank you. One of the ways I try to give back. I don't get paid for those articles. One of the things I give back is by trying to share some knowledge, trying to share some insight, and welcoming any return or feedback from that, from my own growth and development and healing. So, you know, this type of venue right now, for example, is giving me healing. I give, but yet I receive at the same time. You know, like the comments and and the back and forth. It's wonderful. I gotta say, it's it's comforting. It's comforting, It's eye-opening to me. It is to share stories and stuff, and it just, you know, even though it's hard sometimes to bring back those vivid images and putting them into words, it's still a catharsis, right? Pretty much. You're letting go, like just like Doc says, you open your mouth, right? And the pain comes out. I think that makes a lot of sense for a lot of people. Let's not complicate it, for God's sake, for these guys and ourselves. Okay, when I say these guys, I mean us, all of us, right?
Absolutely.
But yeah, all inclusive, and and just to let's bring back their self-worth. Let's bring back their humanity. Let's bring back normalcy of some sort in their lives and in our lives. And this is one of the perfect venues to doing it, is right here. And I write because it's not just an interest in a topic, like you were doing your research. As you know, that's pretty hard, right? To do your research on your papers and stuff like that in school, right? And that's something you must do, but there are other forms where, you want to do it because it makes you feel good, or you're contributing something to somebody else. You know what I mean? And that's
right.
That's the beauty of being humane to yourself and to the other person. That's just an example of what you can do. And I encourage veterans to journal.
Mm-hmm.
I think journaling is a great way to write down your feelings, write down your emotions, write down whatever you need without anybody having to see it right away or anything like that, unless you want to share it. But it's also a form of catharsis, catharsis, right? Getting out getting out the anger, getting out the depression, getting out all of those dark shadows that we are holding in our souls and in our minds. I think that's a good form of therapy, and like everybody agrees, talk therapy, obviously. But this is something I think, there needs to be more of, and it's a shame that the VA doesn't really recognize a lot of it as well.
Yeah. Well, since we're kind of
what can we do? What can we do at a grassroots level, right, to get things done for our veterans?
Yeah. Since
what can we do? What can we do and bring to the VA or to the political community out there, our senators, our congressmen, our council people, whatever you want to call them. Okay, our politicians, to bring a lot of these ideas to the VA.
Right.
Well, as far as the VA,
Dr. Berry, if you don't mind, real quick.
Go right ahead.
I just
go.
Because we are talking about medication and different type of therapies, I want to remind everybody, although Dr. Andrew Berry is a licensed practicing doctor, psychologist, psychoanalyst, he is not here to provide any type of treatment, to replace any type of treatment that your healthcare provider is giving you right now. So please, if anything that we're talking about you brings up any questions for what you might be going through or any treatment that you might be going through, please see your healthcare team. Dr. Berry is not here to be anyone's provider. I just wanted to throw that out there for you, brother.
Appreciate it. Thank you, Luis. And liability is something we always have to keep an eye on. I'm just here for information purposes.
Unfortunately,
ideas. Yeah, exactly. So anyway,
what did Shakespeare say? What did Shakespeare say about the lawyers?
Let's kill all of them. Right.
That's I don't. In a way, I'm kind of like joking here, but we don't want to do that for real. But You get the drift, right?
Oh yeah. So as far as the VA goes, here's what I have heard, what I have seen. I've never set foot in a VA, so all my information is, if you will, anecdotal. All right. The first thing is you don't get paid anywhere near what you get paid in the private sector. Okay? That's the first thing that drives psychologists to not work at the VA. The second thing
Yeah.
is, and I've been told by my heavy combat vets that I wouldn't last 5 minutes in the VA because I'm a bit of a firebrand. I'm a loudmouth. I do things differently. And one guy said, Doc, you wouldn't last there 5 minutes for another reason. They're going to tell you
Yeah.
who you can and who you cannot work with and how you will work with them. And I think, yeah, that's bullshit. And I think Luis has mentioned in the past, it's almost like they're following a formula, okay, with the questions. They make no eye contact with their fucking patients, I've heard. All right. So what winds up happening is you get great training at the VA for internship and residency, but after
Mhm.
you've been micromanaged and underpaid and forced to gargle a formula for the sake of governmental efficacy and other great contradictions in terms, you want to get the hell out of that system as fast as possible and get in the private sector where you can practice psychology and develop your own goddamn way. Thank you very much. Instead of this cookie cutter formulaic, um, what do they call it? Yeah, uh, formulaic formalized treatment or something like that. I can't remember. Nobody wants to have that shoved down their throats because it doesn't work. This is the human condition, my friends. One size does not fit all. That's the first thing. You want to go back a few years for this? Let's go back to Shakespeare. Oh, what a piece of work is man. How infinite, etc., etc., etc. So these cute little manualized treatments. That's it. Manualized treatments out of a nice little manual. You're supposed to treat your patients. So we're going to take the entire human condition and put it in a nice little manual. Can you say like a rat stuffed up a pipe? I don't think so. I don't subscribe to any of this. That's why the VA just plain doesn't work because of the model. And also, let's face it, they are understaffed and underfunded. That's why they rely on meds. Again, getting back to the tiresome mantra of it's cheaper. Now that I've
Yeah,
shot my face off.
I agree. That's why a lot of veterans do not choose to go to their VA. And here in Southern Arizona, we do have a fairly good VA hospital. However, it's not without problems. Again,
Yeah.
it's bureaucracy. It's bureaucracy, and like you say, cost effectiveness. Cost versus benefit of doing something. Unfortunately, that's the case too with managed healthcare in the United States. Who wants an MBA dictating to your medical needs? Right?
But if I may interject, and I know we're talking about, I'll only speak for myself, but I think most of us can agree. There's also is a time and a place for medication. You know what I mean? There's nothing wrong. I don't want any of our viewers that might be taking the medication to help with their mental health to think, oh shit, like this isn't what I should be doing. Then I firmly believe myself personally that there's a time and a place, but if your goal in life is to try to live as medication free as possible, I also truly believe that is very, very possible as well. And there's so many, as we've been talking right now today, there's so many different modalities or different types of therapies out there that can help you live that type of lifestyle too.
Absolutely.
Now,
I
Frank,
agree.
question for you, brother. When I was doing my research for my paper, um, I saw a lot of the models that the VA uses to um, score on, on a scale of 1 to 10 or 1 to 20, how severe a veteran has PTSD or depression or anxiety, all these fear-based models, but I could not find not one questionnaire that talks about moral injury. Have you in your career come across like any type of questionnaire, anything that specifically ask about moral injury?
I have not. Not as of yet, but I've suggested
Wow.
it.
Me, yeah, same.
Yeah. So in my in my personal experience with that, at least the providers were on my VA, they don't seem to care or know that there's a distinction. I've even started out by telling them there's these three buckets, of kinds of traumas, and we can break it down into I saw something or something happened to me would be your PTSD buckets. And then the third bucket is the I did something bucket. And when I explain that to them, just goes right over their heads. They're not even listening to it. They're already focused on exposure therapy is the thing that we're going to do because it's 85% successful. And I'm like, you ever ask yourself who the 15% is? They just, and when Doc Barry and I first started doing this back, and I think when we were Boston Analytic in 2016, maybe 2017, somebody from one of the VAs came out. I don't think it was the one that came from Hawaii. It might have been the one that came from Colorado. And they were just, all they were wanting to do was tout on how they can cure people of PTSD in 13 weeks, 13 sessions. And I was like, really? I'm like, because, where have you ever
By doing
been?
what? Electroshock therapy? I mean, what?
Yeah. Like, because that's what talk therapy is, right? It's curing people. So, I don't know what the answer is. I don't know how to get them to understand. I even waited almost an extra year for a provider who supposedly had experience with PTSD. So they asked me like, "What kind of a provider do you want?" And I said, well, "What do you mean?" They said, "Well, male or female." I'm like, "Well, I don't care." I'm like, "But can I choose on whether they have experience in certain areas?" They're like, "Nobody's ever asked us that before." And they're like, "So what do you think?" And I'm like, "I want somebody who has experience with PTSD." And like, "Oh, wow, we'll have to see." And I'm like, "Are you kidding me? Isn't that like the number one thing people are coming in here for?" And so and I don't know if that's because I'm in a relatively newer VA. It's a healthcare clinic. It's not a hospital, but they had to build a clinic halfway between DC and Richmond because there's so many of us out here. But I just they don't get it. They don't seem to understand what moral injury is, and the toxic exposure list and the Gulf War syndrome list. When they go through that, the person who does the intake is very thorough and answers everything. And once it's on paper or in the computer or whatever they did with it, that was the end of it. That thing ceased to live. Nobody ever connected any care to either of those documents again. And
Yeah.
it just blew me away that I'm just like, really? That's it? Even though I've got severe lung issues, and I told them I rode on the outside of the Amtrak for 4 days, inhaling everything. They weren't even concerned about it. It just nothing clicks, So I think what happened, they just
Diesel fuel exhaust.
well, there was no sunlight. I mean, the particulate matter from the oil well fires just inhaled. We were coughing that out for 6 months after the fact. And
I know.
one of the experimental things you hadn't mentioned, because I don't know if everybody got it, but in the 1st Marine Division, we had experimental botulism. I have a signed waiver. I've got a signed waiver in my medical record that's stamped secret. At one point, it was a secret document for experimental botulism waiver.
Yeah.
That tells you a lot right there. And, and the anthrax too, right? They're like, oh, well, anthrax treatment's been around for a long time, but that's for contact anthrax, not for inhalation.
Not for inhalational anthrax.
Yeah. So there is like the number of disconnects and holes that are in the system, or I don't even know where to start plugging the holes in the dam, Yeah.
Well, you see, there needs to be more. Also, I feel national discussion on this, on an internet and international, because you had We had allies, right, come in and you know, into the you know, into the Persian Gulf, right? So we had what, the UK, I think we had Australia, maybe. We had a few others, right?
We had France.
So
France was on the ground. We almost
France,
lived in that.
France, yeah, we had France. So all of those guys and gals, you know, and like I told you, like the ones that came back with ALS.
Yeah.
I mean, fully neurologically diagnosed ALS, about 37 or 38 patients altogether. A few of those, that cohort belonged to the UK, veterans from the UK, females and a male, I believe. And I don't know about France. That I don't know. But I do know that a lot of the US veterans that came back with that, for example.
So I remember about 95, 96 when we were still calling it Gulf War syndrome.
So yeah, now it's Gulf War illness.
Yeah. So when it was
Yeah.
Gulf War syndrome, I mean, immediately they just, if you were going in for anything related to that, they didn't even hide it. The medical personnel were like, "Oh, we got another one of these Gulf War syndrome guys."
Because
And,
they think it's all psychosomatic
Yeah.
or psychological. That's
And then,
why. And it's not.
And right about the peak of it, when
It's not.
Bernard Rosker came out with his book Gassed in the Gulf, and then Ted Danson made the 2-part film, Thanks to the
Yes.
Great Formation. Right?
Yeah, yeah.
Right when that was coming to the pinnacle, the guys who had it the worst, that had ALS, they all seemed to die all at the same time. They all died off. And
Yeah.
so now the loudest cases were no longer around. And that was right about the time 9/11 started. And rightly so, our focus became that. And then what happened was all the Gulf War illness stuff went by the wayside. Fortunately, it was the Gulf War veterans who kept pushing the exposure. We were calling it the burn pit registry originally. And then,
Yes.
I don't know, Congress glommed it all together and called it
You know,
toxic.
we have the PACT, we have the PACT Act also. We have the PACT Act.
Yeah.
So on the veterans that I've seen with a lot of that, actually have had, I try to, you know, and I try to be very, very careful on how I document stuff. You know, I'm obsessive with documentation. I'm obsessive with researching the case file, you know, and getting deep into it. And what I've seen was, you're not going to believe this. No, you will believe this. I'm sorry. I'm forgetting who I'm talking to. You will believe this. Okay, so here is the deal. Okay, we do medical, like we did medical disability evaluations, right? Okay, so they go off with this. It doesn't go straight to the VA. It gets reviewed by another contractor, let's say, and one of them is Deloitte. I don't know if you've heard of that firm. And actually, you know who, and you know who kicks it back to us?
Deloitte.
Not Deloitte. You know who kicks it? Yeah, Deloitte kicks it back to us. But you know who evaluates what medical professionals have written?
No.
Non-medical personnel.
Oh, that doesn't surprise me. And you know, and if I was Deloitte with all of my defense contracts, am I going to want to rock the boat? I would expect not, you know.
Yeah, but
I mean, I tried to work for Deloitte in a different area.
You mean to tell me a PA or a nurse practitioner or a physician does a medical evaluation and you're going to get rejected by a non-medical person? It's like your insurance company situation. You know, you'll put in a prior authorization, and you know, and some excuse my French, some dipshit with no medical background whatsoever, you know, and maybe has a degree in underwater basket weaving or whatever, you know, sends back your freaking thing as denied.
Yeah, well, you know, that was happening within the, I don't know if it still is, I hope not, but that was happening in the VA system too with claims, right? They had contractors that were working to help them process claims, and non-medical personnel that were under contract. And if they're under a manpower contract, you don't know who's doing the work, you know. It's disturbing.
It's a sad situation that needs to be changed, and I don't know. I'm at my wit's end with people that call themselves congressmen and stuff like that, but I don't know, or congresswomen. Something has to be done, maybe on a congressional level, in order to change the system and make it more efficient and streamlined, and not have people from with non-medical backgrounds who don't know medical terminology or pathophysiology to toss shit back to us and say, hey, we need more stuff. We're going, what's your criteria? We filled out everything we could possibly fill out. We sent you we did labs. We did, we did physical evals. We did EKGs. We've done medical imaging of the lungs. We've done everything. This man is sick, or this woman is sick.
The thing that would work, but is up there with Milgram experiments, would be, hey, if you successfully run for Congress and you get elected, your firstborn must serve in the military in a war zone. That would make a difference.
Oh,
they would carry that.
Maybe. Reminds me of an old CCR Creedence song. Okay, Senator's Son, right? Remember?
Yep.
Yeah. That song for a lot of veterans sings for real. Yeah, that rings for real.
I don't tout the all volunteer force. The all volunteer force lets way too many people off the hook.
Yeah, fortunate son, right? Reminds me of that. I swear to God. And they need to have more politicians. Let them be like Israel. 2 years of mandatory duty, no matter who you are. Seriously.
Yeah. The older I get, the more I see the wisdom in it.
It's truly unbelievable. It's a shame. I mean, I think we need to do some serious work here, some serious grassroots work. And I know that there are PAC groups comprised of veterans and stuff like that, veterans caucuses and whatnot. But, these people are not listening, man. They're just not listening. There's got to be a way to grab them by the cojones, man.
Yeah. Well, I mean, look at the kind of stuff they can say and still get elected. Yeah. So,
and then
it's really a shame.
All the examples already of the unfortunate veterans that not just have taken their life, right, but chose to do so, like you said, at the footsteps of a VA. How louder of a fucking message.
That is a message, for real.
How louder does it need to be?
Yeah, you can't get louder than that. I don't think, unless you wind up in somebody's, congressman's office and do it.
Right. Well, wasn't recently a therapist at the VA got taken out by their patient or something like that happened, right? If I remember that correctly, here very recently, I believe. Don't quote me on that, but I think so. I think it was a therapist at a VA hospital got shot and taken their life.
Oh, I no doubt. I haven't heard it, but I no doubt believe it. I no doubt believe it. And that makes it frustrating for us that work with these VA folks and, and work with the vets directly. I mean, vets love me so much, of course, and I love them. And that is felt in the office. I make sure that vibe gets through, hey, brother, I'm with you, man, let's do this. And, I make them as comfortable as I can. I make sure that, they're in a nice, comfortable environment. They love my bossa nova music on YouTube, with the ocean and stuff showing. And, it kind of calms them down while they're in there, and they got coffee to drink and they got some treats and stuff, you know what I mean? And so we're split up. Like we got audiology, we got and providers that, do general physicals that are pertaining to the particular contentions on their VA claim. So, and we work hard doing this, and making sure that they get what they deserve. This is not this is not fly by night shit. This is stuff that we write together, and we all look into their charts real deeply, and we extract things that they can use to get their claims, approved.
Right. And Frank, talking about getting like claims approved and documenting things properly. Let me get your opinion, and Doc Barry too. Please throw your opinion in on this as well too. So PTSD, anxiety, depression, all those you can find in the DSM-5.
Yeah,
Moral
which
injury.
Doc hates.
Yeah, but we have to use it, right? What's out there we have to use, and to try to fight
I
for
understand. No,
better
yeah.
healthcare. What do y'all gentlemen think, and Nate as well, you two? I'm not trying to disclude you in this conversation, but how much more powerful, how much more research or whatever do we need, and how much will that help out if we could actually get moral injury as a diagnosis in the DSM-5?
I would love that personally. I would love that. I think that would be outstanding. If we could achieve that, that would be a big, big win.
I think that needs to happen, but I also believe that isn't the VA going to decouple themselves from the DSM-5 when it comes to PTSD? I thought they were going to no longer go, but I could be way off. I could be wrong, but I thought I'd read
I've also heard that they're going to not use the diagnostic standards in those manuals. Like
that's probably what I heard.
Yeah, I heard the same thing.
Yeah.
I heard the same thing. However,
So
remains to be seen. Yeah, yeah. Oh, by the way, do you remember when they were going to cut the Gulf War Registry? Remember that?
Yeah. Oh, yeah. It's it's just like the law that they just passed not too long ago, right? On how they're going to calculate percentages, and everybody were like, "Oh, okay, it's okay." They reversed themselves. No, they didn't. The law still stands. All they said was that we're not going to enforce it, which means when nobody's looking again, it's going to happen.
It's going to happen again. Yeah, I agree with that.
They didn't bother to rescind the law. They didn't change it. It's still there. It's just a matter of time for people to forget, and then it'll happen.
Yeah. Brother, I agree with that because, I could see how many times in the past that they've spoken with forked tongue, let's say.
Yeah. Well, there was just kind of squirrel, but something just occurred to me too, Frank. Also, one of the things that a lot of people don't realize that was in the first Gulf War was 120 millimeter VX rockets. So,
yes.
So
I do know.
A lot of that stuff that got to the Camisea, they called it a weapons depot. I don't know why people aren't questioning why would Iraq conveniently put all their stuff in one place for us. All the stuff that we collected outside of Kuwait International Airport, including 120 millimeter VX rockets and chemical landmines. How did all that stuff mysteriously made its way over there to Camisea to be blown up all by itself?
Yeah.
Yeah, it's
and let's not forget that a lot of alleged WMD materials went south.
Yeah. We only make movies about when things go horribly wrong for us, but we don't make movies about when things went well for us or horribly wrong for the enemy.
Yeah.
And so this is one of those things that'll always be in the margins.
Well, there are quite a few veterans that got caught in that plume and, have been exposed. And let me tell you something else. Having been nuclear, biological, and chemical guy too, I could tell you that those detection systems, They're not always false positive.
Oh yeah, no. So we had the German Fox recon vehicles with
The,
us,
the Fox Recons, yeah.
and every time
The Czechoslovakians are the best at it.
yeah, and every time we had a positive identification with a Fox vehicle, the argument that was made by I think might have been DIA. I forgot who worked all it was it might have been DTIC. I'm not sure, but
You're talking about DTRA,
I don't know,
Defense Threat Reduction Agency?
Remember there used to be a website called GulfLink, and then recently they moved it. Now all the links are broken. But
Yeah, of course.
they would look at every single event, and then they would explain why that chemical detection was not correct. So if the Fox vehicle detected it, they said, "Oh well, the M256 kit didn't detect it, or the M9 tape didn't reflect that." And then if you had an M9 tape, which has a lot of problems, and the 256 kit has problems, but when we'd have a detection one of those, they said
Both of those
we
two
didn't confirm
systems,
it.
the
We didn't
M9,
confirm
the
it with the
M9 and
Fox.
the M9 and all of the other stuff too. I mean, the strips that we used to use,
Yeah.
and yeah, all of those are colorimetric. Those
What does
two
that mean?
systems are that means that they change color,
Oh yeah,
and
yeah,
that's how you know that an agent is present.
yeah.
Not the most accurate way, but
Yeah.
but at least it's a preliminary finding that says, hey, something's in the air.
Yeah, but they would.
You
But
know,
what they would
and
do is
and
they
to
would
go
use,
into your mop gear.
yeah, they would
You
use
know.
the two different detections types to contradict each other. It's like, okay,
Yeah.
well, which one you saying this one was not reliable? Use the other one, and then in another case, you say that one's not reliable. Use this one.
Yeah, exactly. But I think the agency you're talking about is the Defense Threat Reduction Agency, which deals with a lot of WMD threats.
Yeah, I've got a friend who is about to retire from there.
Yeah, Detroit. Yeah, I have a friend of mine that was a contractor for them who was actually in the 7th Special Forces Group.
Oh yeah, speaking of contractors that do DTRA type stuff, that's a lot of people don't realize too that before large scale things happen, 3-letter agencies tend to go in and spirit a lot of stuff out of the country before anything else happens, before there are a lot of eyes on those locations.
Oh yeah, for sure.
Yeah. And so that kind of stuff, all you got to do is go back to the 1980s and look at the newspaper articles. Who built the chemical weapons systems for Iraq? We did. That's how we know they had them. But we don't play that game. We act like, oh, we can't find them. Maybe they didn't have anything. Like, no, I remember that we built it for them and armed them so they would fight Iran with them.
How did what's it called? Bin Laden
Saddam
and his
Hussein
associates gained expertise and became mujahideen. It's because special forces troops went in there to train them to fight the Russians.
Yeah.
See, so everybody is sleeping in each other's beds, huh?
Yeah, yeah. The enemy of my enemy is also my future enemy.
There you go.
There you go. Yeah.
There you go. Well said. Well said. Yeah.
Yeah.
But anyway, having said that, between all of these different multifactorial things that are going on in battlefields, especially the modern battlefield, and I think I think one of the worst things in terms of exposures is the burn pit, which is ubiquitous. I think that's one of the worst ones that were ever found. And the Gulf War was very, very unique because Saddam Hussein was using environmental warfare, ecological warfare, scorched earth policy. So, and that's why a lot of those exposures came about, especially with the oil fields. Nasty, nasty, nasty materials there. Benzene, all of that good stuff. Particulate matter.
I agree with you, though. The most prolific and the biggest common denominator for across the 700,000 force was the burn pits, because everybody, unless you were back in a camp someplace in a population center, everybody was burning their trash every day. Everybody was on working parties to go out to the trash pit to make sure that everything was burning. Yeah, that's the most common thing. But
Yeah.
unfortunately, that has taken the front of this. It's taken front stage, and so all the low level exposure stuff, the combination of PB pills with permethrin spray multiplying toxicity.
Permethrin spray on your uniforms.
Yeah.
DEET. Yeah.
I'm glad that you two mentioned that, because I was going to ask actually. So even for post 9/11 veterans, right, the ones that went into Iraq and Afghanistan, I'm not sure if like all the way through the whole war, but I still registered for the burn pit registry. And one thing that I didn't realize until we started talking about this right now, and maybe because I was doc. Doc normally doesn't do this. Like, I didn't have to go throw supplies into a burn pit. I didn't have to sit there and stir a 55-gallon drum full of shit and piss with diesel fuel and make sure it all burns. But the one thing that I did do was, when we're clearing out medical spaces, was take boxes and boxes of medication, immunizations, and I wonder how that can affect
And you
as
and you
well.
incinerated in the field, right?
Yeah, you incinerate it and you're sitting there breathing in the smoke of all
Yeah.
these different combination pills that are, or vaccines or injectables, you know what I'm saying, that you put into IVs or whatever,
Yeah.
and now that's just and I never thought of that until y'all mentioned that, especially with the whole DEET thing.
Now, going back to some of the stuff that I've seen, I mean, one of the areas I trained at was Dugway Proving Grounds in Utah. And I actually took the Advanced Chem Bio Incident Management course there, which was an eye-opener. And as you know, Dugway tested chemical and biological weapons, and they also did some stuff on radiological, not nuclear, but radiological, like the radiological dispersal devices and stuff like that. And they did stuff on, on like tanks that were actually, their cannons were actually flamethrowers, things like that. And they also tested a lot of protective equipment, mop gear and otherwise. M40 masks, etc. So having worked there, I know that there was some real trouble with waste production and management there. And a lot of folks, military and otherwise, were exposed to a lot of things. They had an aerial dissemination of VX that killed off a lot of sheep back in the day, from a local rancher there. That was a big to do about that, and other things going on too. But another thing I noticed too is that, for example, like areas like Nellis and all that, we're talking about stealth technology, and
I was at Nellis.
Yeah, plastics. Okay, well, materials that were used to build stealth bombers. The B-2s that we now see all over the place. And so there was a lot of exposures from stealth technology that people faced as well. So that's another aspect. Back in on 91, we're looking at too depleted uranium. That's another thing. DU.
I was
Which
a gamma,
actually-
I was a gamma emitter up until, I got tested in 1998 or 99, and I was still a gamma emitter. But
Did you go through a whole body counter type of thing?
it was done at a local hospital where I was at a college. But by now, it should all be gone. It should be processed out of me by now.
Yeah.
But the damage to my DNA is done. So.
But here we go with DU. In terms of veterans' health issues, depleted uranium also is a toxin to the kidneys. So, you absorb depleted uranium. Okay, it goes into your lung and it becomes a local emitter for the lung tissue. You inhale it, right? And so what happens there is you get that local irradiation from that, and it can cause like lung cancer, what have you, or some type of radiation fibrosis of the lungs where there's lots of scar tissue.
So I
You
have
know?
I have nodules in all 5 lobes of my lungs, and they can't tell me
Well,
where it came from.
This is what I'm talking about.
Yep.
Yeah. So there was a lot of
We
that.
used to sit on top of ammo crates of depleted uranium rounds.
Depleted
We would
uranium,
put 'em-
yeah, right.
We put them in our
And
sack.
yeah, right. And your ass gets microwaved, right?
But the for people who are watching that
Unbelievable,
might not
man.
know, the way that depleted uranium exposure came for most of us in the Gulf War was depleted uranium rounds would impact armor and
Yeah.
light skin vehicle, and it would produce a fine dust or a powder, which then would land on the battlefield or on those vehicles. And then the next person who goes over to search those vehicles to look inside, you're kicking it up and inhaling it, don't even realize it.
Well, definitely resuspension, dust resuspension. And anyway, depleted uranium too, like I said, is a kidney poison. It'll poison your kidneys for sure. And not only is it that, but it's also a radiation source, which is also a problem. So you have a dual threat right there in just one particle of that stuff. Another thing too is that biologicals that they might have been exposed to in the Gulf War was leishmaniasis is one of the diseases, from the dust itself. It's an organism and it grows in there. It's endemic to the area, and people weren't really protected against that either. So there's a number of things. But going back to what, how many of these chemical exposures also have a neurotoxic effect, right? Poisoning to the nervous system and can get into the blood, past the blood-brain barrier, affect the neurons, and add to injury to the neurons, right? That contributes to neurobehavioral effects, which you as a clinical psychologist and Doc as a psychologist could manifest as a behavioral disorder, especially like organic solvents and heavy metals and things like that. So that's another issue that needs to be fully researched and addressed. There are so many different multifactorial things that, because we love our country so much, that we decided, to go ahead and do it, but not told about everything.
Yeah, and in 20 or 30 years.
So you talk about Doc mentioned betrayal. I think, not knowing and not being given that information is a part of betrayal.
Yeah, in 20 to 30 years, if they haven't done anything, the problem will fix itself because there'll be almost none of us left.
Well, let's say God forbid to that, but let's hope we can, all do something. I see a pretty smart panel in front of me that is patriotic, and by the way, I failed to thank you guys for your service, and all of you. And I think it's pretty amazing what you folks have gone through and done for your country. It's to be admired, and obviously, but it's also to be it's obviously necessary to be given your just due as veterans to ensure that you don't get sicker or sick or any of that stuff, and that you get proper treatment. And that's just one of the top things in my heart that I want to do, for fellow responders and veterans, of course.
What I started telling people when they thank me for service, as I've been telling, because it makes them think when I say it, is I've been telling them it was my solemn pleasure.
Yes.
And it makes them think about what did he mean by solemn?
Yes.
You don't
Solemn.
use
Yeah.
the, you don't
I
use
got
the,
it.
don't thank me, thank my recruiter. And I'm just-
I got, yeah, I'm amazed. Yeah. Yeah. You know, it's interesting, kind of like in my particular case where my recruiter said that I'd be I got a spot for you. And he said it has to do with physics, it has to do with chemistry, metallurgy. What is it? I'm a dumb kid. What do I know? I didn't even know what the hell an MOS was, right? I said, you're going in as a nuclear weapons specialist. Because I told him I wanted to do something with science. I wanted to do something like, to be true. I mean, that I did because I trained a lot of guys on SF guys. That's how I got into SF eventually, is training a lot of guys how to use SADMs, special atomic demolition munitions. You know, the old, what do you call it?
We had
Backpack boots.
Yeah, it's like we had 8-inch howitzers.
Yeah, and you had the Davy Crockett system.
Yep.
You had that delivery system, Davy Crockett.
Yep.
Tactical
Nuclear artillery.
nuclear artillery, yeah, and mines too. Actually, there's some mines also out there. I don't know whatever happened to those guys, but probably a thing in the past or buried someplace.
That might have been part of that destruction they did of that site up in Oregon, maybe, where they incinerated everything.
Oh yeah, Umatilla.
Yeah.
Umatilla.
That
Yeah.
place, that place, driving past that place, I was just like, is that it kind of looked like a cemetery almost, all the mounds.
I provided medical support at Johnston Island over there, where they did a lot of the
Jonathan
chemical demilitarization.
Wow.
My old stomping ground was Fort McClellan back in the day. Anyway, so yeah, definitely going back to moral injury should be a diagnostic classification. I 100% agree with that.
Me too.
Amen.
Gentlemen, we are 2 minutes before our 2-hour mark. So just want to use these last 2 minutes to see if anyone has any last minute thoughts before we wrap things up. Doc Barry, anything? Can't hear you, brother.
You have to get a little louder, Doc.
How about now? Can you hear me now?
Very good.
Yeah, we got you.
Okay.
Yeah.
Okay. Nate and Luis have seen me do it in person, and Frank, you've seen me, so to speak, on tape.
Yeah.
To change minds, we tell stories. All right. Research, elegant research certainly is part of the equation. Just
Yeah.
not my thing. But when I use, let me put it this way. When I use a storytelling approach to post-traumatic stress, no jargon, no clinical vernacular, but all the symptoms are included. But I use a storytelling approach. I'm here to tell you that drives the point home so much more effectively than a traditional clinical recitation, regurgitation of the symptoms barfed up right out of the DSM. And and while those kinds of presentations are entirely true, they are not, in my opinion, the entire truth. It's the stories that go along with them, how it affects interpersonal relations, how moral injury factors into it, how the body changes. And as all of you have heard me say before, a person goes into the service as person A and they come out of their service as person B because their central nervous system, their brain, has been affected by combat stressors.
Yes.
And a lot of people are not aware of that. They think it's just a list of symptoms. Oh, hell no. And is it any wonder when somebody comes out of the other end of their system, or the other end of their service, they don't know fucking who they are anymore.
Yes.
They're not
Yeah.
the same person. And that's how we get the point across.
And that's true. And the thing is that I, for a long time, didn't know who I was. Um, and I was very stoic about it. And that's, I think, part of the problem right there. Is to know that you're so tough and you went through the military, you went through first responder training or whatever it is, and you are so tough that you are at this point stoic and I can handle it, and you turn out to be wrong. And you don't want to be opened up as a person to reveal your inner I'm not going to say weakness, but your inner emotions and everything else, because sometimes you are trained into retaining that, or I should say, uh, trained not to open up and trained to suppress your emotions, and trained to overcome, adapt, improvise, and all of that good stuff, right? That we used to do. And
Which becomes
so
suffering in silence.
it becomes suffering in silence. Exactly. You took the words right out of my mouth. And that's what's happened to most of us, unfortunately, until we learned to let other people that we trust into our lives, and to be able to maybe focus on that a little bit, and focus on what's really the hidden demons behind us that we refuse to release. And some people are good at coaching, and like Doc says, out of your mouth, and get all of those feelings out. And it's like it becomes like a sewage outflow.
Right.
And
hey, Frank, to riff off your metaphor, to be stoic, all right, keep it all inside, is you find out over time to dehumanize yourself.
exactly right. And that's, yeah.
Nate, any last minute words, brother?
Just that I feel like we barely even scratched the surface with Frank today. And look forward to having you again sometime.
Absolutely.
Yeah, I would love it. Yeah, we'll go more into maybe. I'd love to go into more of the moral injury stuff.
Me
Yeah.
too.
I know this is my first rodeo with you guys, and I appreciate your listening to me and allowing me to speak my mind on things, and express my love for our brothers and sisters in and out of uniform at this point. And I'm hoping to do it again. I'm hoping to do it again sometime when you guys feel comfortable with that.
Hey, the invite's always there, brother. Get on the calendar, and we'll be happy to have you back as early as you want. And it's funny, veteran Valhalla 6303, for y'all that didn't read it, put on here. They didn't include emotions or feelings in our sea bags, so that means we don't need them, right? And that's I think
there you
it's kind of
go.
like
See,
it's kind of like the your family didn't come in your sea bag type of deal. That
yeah,
old school thinking
yeah,
mentality. It's
yeah.
bullshit. But I want to say this before we close off: is this, if you're an active duty member, if you're a person, doesn't have to be active duty, veteran, first responder. If you're a person that is seeking mental health treatment, and you genuinely do feel inside that you got a handle on maybe your depression, your PTSD, but there's still some sort of guilt, some sort of aching feeling inside of that, say that specifically to your provider. And if your provider doesn't start changing the way they start treating and or talking to you about that specifically that you have just spoken about, it's okay to end your relationship with that provider and seek another one that you feel comfortable that they know what they're talking about when you talk about things of guilt, of things that maybe you've had to have done while performing your duties, or things that you might have seen, or the betrayal that you might be feeling from, it could be your family, it could be your work environment, your organization, whatever it is. Start using these words and start forcing these providers to really start doing their job and really diving deep into how these providers can best assist you to live a much healthier and better lifestyle.
Actually, that's excellent. Absolutely. And I agree with a lot of that. And I hope people begin to open up even more to us on that of what you said. And like you said, they do not have to be veterans. They could be people in search of answers, in search of need, in search of just talking. How about just talking?
There
Okay.
you go.
There you go. Just talking. I'd like to just one more time, I'd like to recommend this book to any veteran or any first responder actually that's going through stuff. And let me just read. Okay, so this book reveals, okay, that the hidden wounds of war aren't always physical, and war can be a confrontation with a suspect, an armed suspect for a first responder or a fire or something. Some break something deeper than flesh, and we were talking about that a little earlier. It reveals how moral injury is often misdiagnosed as PTSD, and how recognizing that difference could save lives in today's veteran suicide crisis, while reminding veterans they are not alone. And veterans out there, first responders, people with the need to talk about your crisis. These gentlemen up here, they're all with you, and so am I. We love you all. And let's remember, leave no one behind.
Amen.
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 And with
Amen.
that,
Amen.
thank you all
And
for tonight. And if you
God
made it
bless
this-
God bless our veterans, our first responders, and God bless you guys for doing this.
Thank you. Thank
It's,
you, you as well.
it's amazing. Amazing.
And if y'all made it to this far of the video, please give us a like, a subscribe, and give us a share. And we'll see y'all on the next one. Have a good evening, everybody.